I really love this community. We've moved here kind of between 8 and 9 years ago, and we really wanted a really nice climate and a nice area to be in. And so once we found that in this community, then we've really kind of dug in our roots. My wife has her business here in town, and for me, joining Bradley was perfect because it allowed for me to have that institution that could really work with us and help us get into the community even deeper than we already are. I really want people to be able to come into the orthopedic care in their own community because having to travel for things just really complicates things. It makes things difficult, it makes things stressful. And when you've got the amount of orthopedic experience and knowledge that we have gathered together with our team here, we can really take care of just about everything. I really enjoy doing total joints. And so total joints is one of the things where you have knee replacements, you have partial knee replacements, hip replacements, hip arthroscopy, and then you have shoulder arthroscopy and shoulder replacements. And I perform all of those procedures. My fellowship, my extra training that I have was really in the hip and knee, where I got subspecialized within orthopedics in order to do minimally invasive anterior muscle sparing approach to the hip, where I can do minimally invasive partial knee replacements, full knee replacements that use that robotic technology in order to really get a customized fit and a customized feel for the patient. So they are patient specific because it allows me to customize directly to our individual patient's needs. I really bought into the orthopedics and the robotics technology because it allows us to be very reproducible. It allows us to give feedback directly while we're in the operating room in order to adjust things on really small values. 1/2 millimeter is the accuracy that these things have, so it allows me the freedom to be able to adjust and plan out my procedure. That really allows me to take that knee replacement, to take that hip replacement to the next level. And that's what I really enjoy doing. I'm very excited. We're gonna have people with experience in sports medicine, hand upper extremity fellowship trained surgeon, myself with the fellowship in total joints of the hip and knee. We have spine care. We're the only ones in the area that take care of the spine with Dr. Hutchison. And so having a team of all of us really allows us from spine all the way down to hip, knee, down to the lower extremity to be able to take care of a patient's needs right here. We don't have to travel, to some of these other places in order to get it, because we've got the most either technologically advanced with the robotics program, and then we have the fellowship training that allows us to really take care of everybody. When it comes to knee and hip replacements, I love seeing my patients get up and move. I send between 80 and 90% of my patients home the same day. So when it comes to getting a hip and a knee replacement and really wanting to be able to recover in the comfort of your own home, we've been able to create those programs here that allows us to do our techniques, our muscle sparing techniques, our minimally invasive techniques, get people up and walking with the physical therapist the same day. And that way you have a very comfortable feeling with being able to go home because you've already walked a football field and a half. You've already climbed up and down 12 stairs. You've been able to eat, you've been able to drink, you've been able to go to the bathroom. And so those are the major things that you're gonna need to do in that first few days to a couple of weeks after surgery. And so we've already done those things with you on the day that we've replaced your total joint. And so it creates that comfort level for getting people home. And my grandfather was a tinkerer, and so he was a mechanic, and so I kind of had this mechanical brain that developed as I was growing up. And so I liked to take engines apart, and that has kind of come forward with me into my practice. I like having my patients understand what the problem is. I draw pictures. I really try to explain and get an understanding of why the joint hurts, why the shoulder, knee, or hip hurts. thing that excites me the most is really when I can get my patients up and moving. And so from my standpoint, being able to get people back to the activities that they love doing is something that means a lot to me, because I enjoy doing things. I like to play pickleball, you know, I do my golfing and my cars activities, and I know everybody else enjoys doing those things too. And so to be able to help somebody and to have that privilege to help them, you know, is something that really allows orthopedics to be near and dear to my heart.